All right. Can you hear me now?
Yes, I can. How are you?
Good, good. I'm doing well. How are you all?
Doing good.
Good, excellent.
Thank you. I really appreciate you coming here to talk to us today.
Of course, it's my pleasure. Happy to help.
Thank you. Thank you. Okay, so we can go ahead and get started.
Okay.
Hello, my name is Brianna Shaw, and I'm the president of GVHS Medical Society. Please join me in extending a warm welcome to Dr. Ravichandran-Kumar, a highly accomplished double-boarded physician in internal medicine and lifestyle medicine, with over 15 years of experience in hospital medicine and primary care. She currently serves patients at Reliant Health Primary and Wellness Care, where she focuses on optimizing recovery and ensuring seamless coordination across the clinical continuum. Originally from Boston, Massachusetts, Doctor Ravichandran-Kumar completed her education and training on the East Coast. She earned her medical degree from the Philadelphia College of Osteopathic Medicine in 2009, followed by a master's degree in medical education. She has also achieved fellowship status in hospital medicine. Since moving to Las Vegas in 2013, Doctor Ravichandran Kumar has been a passionate advocate for advancing medical education in Southern Nevada. Her commitment extends beyond clinical care as she actively promotes healthy living through lifestyle medicine, emphasizing the importance of proper nutrition, regular exercise, and overall wellness. Doctor Ravichandran Kumar's dedication to patient-centered care and her exemplary contributions to medicine have earned her widespread respect among her colleagues, which is a rare and distinguished accolade in the medical field. Dr. Ravichandran Kumar, we are honored to have you share your valuable insights in a fireside chat with the GVHS Medical Society. So we can kick this off with our first question. So this question is about a day in the life. Could you walk us through a typical day in your role at Reliant Health Primary and Wellness Care? What are some of the most rewarding and challenging aspects of your work?
Of course. So when I walk into my clinic in the mornings, the first thing I do is I greet my staff. I have front desk staff, I have medical assistants, I have medical students with me. And so we review the plan for the day. We check if anything logistically is missing, such as medical records. I take a look at my schedule. I see how many patients I have and what are they coming in with today. And I get my cup of coffee and get ready to start the day. Then the next part of my day is actually seeing the patients themselves. So patients will come in with all kinds of concerns or issues. Some people come in for regular checkups, just well checks. Some people come in with chronic disease management concerns, like maybe they need medication adjustment for diabetes or high blood pressure or asthma. Some people come in for sick visits. They may have a cough, they may have a cold, they may have a fever or other issues that need immediate care. So most of my day is spent directly in patient care, but then there also is another part of the day that is spent behind the scenes doing a lot of the things like medical charting, medication refills, sending prior auth, sending referrals. So a large part of the day is also spent in doing some administration tasks as well. Some of the more rewarding parts of my day, I would say, is really building those patient relationships. A lot of the patients, we take care of families, husband and wife couples, maybe grandparents that are coming in for medication refills and all other questions or concerns. But a major part of it is that rewarding patient care and provider relationship. Another rewarding aspect of my day is actually seeing a variety of conditions. So I don't see the same thing over and over again. I see a whole bunch of different issues come up during the day. So it always keeps me on my toes, so to speak. So I get that, that challenge that I get to see different things happen all day. Some of the other more demanding things, I would say, is just the administration burden. I think when you asked me, Brianna, some of the more difficult or more challenging parts of primary care, I think, is the amount of administration burden that we have, the amount of documentation we have to do on the ends. We spend a lot of time, uh, working with the insurance companies to make sure medications are getting approved. We also spend a lot of time, talking to patients and making sure they're able to get in to see their specialists on time. Um, a lot of primary care is also impacted by the time constraints. When you get to see a primary care provider, sometimes you only have 15 to 20 minutes to really address that particular concern that brings you in. And that can be challenging at times.
Wow, that was a really great answer. I really do resonate with a lot of what you said. Like, one of the things I resonate with is I feel like that's very good time planning skills and time management skills. And that's kind of what I try to do when I know that I have a day where I have like a lot of stuff to do. I try to, when I wake up, like, let's write it down, try to plan it well. And yeah, I'm really inspired by the lifestyle medicine. Since November, I have been kind of trying to change my family's diet habits. So every week on Sunday, I write a meal plan for the week. I write down all the ingredients needed, I buy them all, and I'm cooking every night for them because I want to kind of get my family on a healthier meal plan. So that's definitely, I really resonate with that. And it's really important, the value of nutrition to keep, my parents healthy, my little brother healthy, me healthy. So yeah, I really resonate with that. And especially about the struggles with administration. I'm seeing some of that firsthand with a situation that my brother was in. And yeah, I just remember, my mom's on the phone with the administration of these facilities, and she's like knocking on every door trying to get his medications for him for, his pain. And it's like, I definitely see the struggles of administration. It can be slow, it can be definitely a lot of pressure on the families and also the doctors there. And yeah, also lastly, I really do resonate with the plus of getting to see a lot of different people with different conditions, but especially just getting to know different people. And you really do build rapport. So that is definitely really cool. Like, my older brother, like I mentioned before, he has a nurse who he made a really well rapport with when he was at UMC. And it was so cool because once my brother got to physical rehab, that nurse actually went and visited him and brought him like a big basket of snacks, some nice Arizona teas, and he even came right before Christmas and gave my brother a nice Christmas gift. Like, these rapports are really powerful and they really mean a lot, not just to the doctors, but also to the patients receiving it.
Yes, that's definitely a very good point. I think all the things you mentioned there happen more often than you think, and it really does resonate with me because that's the reason why we always tie into everything that we do with purpose. So, even if those days are difficult and I know, hey, I can't get this medication approved by the insurance for you, or hey, I only have 20 minutes to, kind of help you through this particular issue. I always think to myself, you have to realize what you're doing every day is tied into a purpose. And so when you have those tough moments in whatever field you're in or whatever you're doing, you have to think to yourself, hey, why am I doing this? What's the purpose of me doing this? And it helps tie in those difficult situations and keep you moving forward, so to speak.
Thank you. That is really good advice. And I will definitely use that not just for my future career, but I think that advice can tie to a lot of things you're doing in life if you're ever like for me, starting to go to the gym a lot, something like that, like the motivation for anything in your life. That's really wonderful advice. Thank you.
Yeah, of course. No, I'm really proud
Mhm.
of you. I think good health really starts with the individual. It really starts with you taking the time to move, get your body exercising, eating well, sleeping properly. I think those are some of the basic things of health that we all have control over, and we just have to make it a priority. So good for you. That's
Thank
great.
you. Thank you.
Hi, I'm Jamie. I'm the Vice President of Green Valley's Medical Society. My question for you is, what advice would you give to high school students interested in pursuing careers in internal medicine or hospital medicine? Are there specific skills or experiences they should focus on now or should worry about now?
That's a great question. I'm glad you asked that question. I think I would probably answer that question in three parts. I think if you're interested in medicine, there are definitely three major steps you should take. The first step, obviously, I think we all know about is just being really strong in your academics, taking the math and science and communication skills very seriously, because that's going to be a big part of your portfolio. So we all know step one is just to get good grades, right? Step two has to do with really immersing yourself and learning more about the medical field. Get involved in volunteer opportunities at local clinics, maybe volunteer at a hospital, talking to people who are in the healthcare field like myself, and just getting some exposure and doing your research and what it is, and to be in the medical field is important. So definitely getting involved in community programs, volunteer work is huge. And this is the part of gaining experience and doing your research into um, various health, exposures, health fields. The third part of the question, I would say, is really honing in on some of the skills that are important in medicine. And some of these skills, as you alluded to, Brianna, are, time management. I think time management starts when you're young, like yourselves in your high school years, learning how to balance your extracurricular work, your school work, your family obligations. Time management is a skill that you develop very early in your life, and that will carry you far in your careers moving forward. The second skill really to develop at a young age is empathy. I would definitely encourage everybody to get involved in some kind of community activity, whether you're volunteering in soup kitchens, whether you're in a Big Brother, Big Sister program, whether you're doing mentoring, really participating in any kind of community event that'll help build your empathy skills and your leadership skills is huge. So you really want to kind of start working on that. But overall, developing critical thinking skills, empathy, leadership skills, any activity that promotes those things will help you um, get more involved.
Thank you. I really agree with the empathy part because I think empathy is really important, especially in being a doctor. I want to be a pediatric doctor. So, I want to be a pediatric surgeon actually. So I feel like you have to have a lot of empathy and, leadership skills in order to even work with other humans. But I really agree with what you said, and thank you so much for saying it.
You're welcome.
Hi, I'm Basil. I'm the secretary of GVHS Medical Society, and my question is on the impact on Southern Nevada. You're a champion of improving medical education in Southern Nevada. Can you share some of the ways you've contributed to this effort and how students, I guess, might get involved in similar initiatives?
Of course. So I'm also adjunct assistant professor at Torah University. So I'm on the roster to teach third and fourth year medical students. So they do their internal medicine clerkship with me. And I love working with those students because it gives me an opportunity to teach them the art and the science of medicine, But at the same time, I am able to offer mentoring relationships to these students. And so for me, that's one way that I feel I can make a difference in the medical community of Southern Nevada by mentoring and teaching medical students. For you all at your stage, in order for you to be a part of the medical community and being involved in some similar initiatives, I would highly recommend working with an institution like Toro or UNLV and getting involved in some of their community outreach programs that would really give you an exposure to healthcare fields, as well as fine tune some of those characteristics like leadership and empathy and critical thinking skills that are needed to be in this field.
Thank you so much. I think that it really is important to like get hands-on experience at this age. And since our club is already toured at Toro and some other medical hospitals, I think that is another way that we can like take a step towards that direction of becoming really great medical leaders in the future. So thank you so much.
Of course.
Hi, I'm Kieran, and I'm the treasurer of GVHS Medical Society. My question is on pivotal changes. So, what has been one of the most challenging cases or situations you've encountered in your career, and how did it shape your approach to medicine or patient care?
All right. So, um, this is a great question as well. I think we've all had experiences where we've known someone that was either in the hospital or required medical attention, and it was a little bit of a challenging journey, but we all have witnessed to some of these experiences, and I think it teaches us how to move forward in similar instances. For example, I had a family member that went to see their primary care doctor for a rash that didn't go away for several visits. The first time they went to the primary care doctor, they couldn't figure out what the rash was, and they gave him some steroid cream and sent him home. The rash didn't get better, it actually got worse, it spread, and they developed a fever and irregular heart rate, and they just kept getting sicker and sicker. And so finally, the primary care doctor said, "Hey, you know what? I'm not quite sure what's going on. I'm going to send you to the hospital." This patient went to the hospital and the heart rate was really irregular. And they just, said, "Hey, we're going to admit you to the intensive care unit because you may need a procedure to bring your heart rate back to normal." This patient was seen in the hospital by intensive care doctors, internal medicine doctors, infectious disease doctors, internal medicine doctors. And finally, they realized that this was not even a heart issue, it was actually an infection issue. The patient had something called advanced stages of Lyme disease, and the cure was just antibiotics. But it took someone really smart to say, "Hey, listen, this is not a heart issue, this is an infection issue, and it can be cleared by just giving antibiotics." And to me, I think the fact that you can be so sick being in the intensive care unit with someone ready to do a procedure on your heart, and then the next day, get antibiotics and feel better, it was a huge life change for me, because this means that once you figure out what's wrong, that's the hard part. The actual diagnosis is the hard part. The recovery can be very quick. And this patient recovered very well once they got their antibiotics. Heart rate returned to normal, rash was gone, the fever was gone, and they learned a lot about Lyme disease and how it can affect the body head to toe. And more importantly, when I spoke to the patient and I said, "Hey, are you going to change your primary care doctor because they couldn't figure out what was wrong with you and you kept going there 3-4 times?" And the patient said, "You know what? My PCP, my primary, tried their best to figure out what's wrong and um, send me to the dermatologist, send me different medications. But at the end of the day, they actually stayed with their primary care doctor, even though they couldn't make the diagnosis in the beginning." That point to me really emphasizes that, when it comes to the provider and the patient relationship, you really have to trust your doctor, and you really have to feel that this person cares for you. And I think that's why so many people these days stay with their primary care doctor for, years and decades, is because they really had that trusting relationship. And one of the things you learn from this experience is that sometimes it takes a little longer to figure out what's wrong. Sometimes it takes two doctors to figure out what's wrong. Sometimes it takes being in the hospital, being seen by, various different specialties to get to the diagnosis. And so this whole experience was really pivotal to me, because it showed that the medical community is not just one doctor, but it is really a network of people that work together for the same goals.
Thank you so much for your insight. It's very helpful to all of us that are considering entering the medical field, because it's important for us to realize that we'll face challenges in our career and we'll have to come up with solutions to overcome them. And also, it allows us to see that if one method isn't working out, it's okay to change our approach for the future to avoid these challenging situations. So thank you very much.
Yeah, of course. I think it's a great question, and you all will have different challenges moving forward in your career. But if you learn how to problem solve, and you learn that you have other people as resources to help you along the way, it makes these challenges much easier to deal with and develop and endure.
Hello, I am Aaliyah. I am the social media director of the Green Valley Medical Society, and my question is on balancing wellness and career. You advocate for a healthy lifestyle, including proper nutrition and exercise. How do you personally maintain balance and wellness while navigating the demands of your medical career?
Well, I always tell people, I say, you can't take care of other people unless you take care of yourself. And so I think taking care of ourselves really involves four components. To me, it's number one, it's nutrition. Just like Brianna said, you have to take a minute and just see exactly what you're eating every day and make sure that it's healthy and nutritious. There's a really good quote by Mike Poland, and he says, eat food, not too much, and mostly plants. And it kind of simplifies it, because when you say eat food, you want to eat food that you know what's in there, right? When you eat, a potato chip, right? It's great, but you always ask yourself, like, hey, how is this made? How did this come about? You want to eat food that you know how it's made, and it's not super processed, and it's delicious, and it's as raw as it can be, meaning not too processed, not too much added sugars or salts. The second thing is, you want to make sure you eat, but, kind of stop eating when you're at that like 85% mark, right? You don't want to eat until you're like 120% and you're going to feel like you're going to puke or anything. So eat real food, not too much. And I always add the mostly plants part, because I think it's important these days to realize that fiber is a nutrient, and we really need to get more fiber into our lives. And then so the best way to get that is through fruits and vegetables. So I always say, hey, if you have a minute, try to get in your fruits and veggies to be super healthy. And then exercise, I think important part here is to realize that the exercise is so important for our mental health, and helps really with a lot of stress management for me specifically. So one of the things that I do to incorporate exercise into my life is I exercise in the morning. Friday, Saturday, Sunday mornings, as soon as I wake up, I just make it part of my routine. I go 40 minutes on my stationary bike, no matter what. So exercise to me, I don't really think about it anymore. I just sort of have it in my schedule. Just like you wake up in the morning and you brush your teeth, or you wake up in the morning and you comb your hair. I wake up in the morning and I exercise for 30 minutes, 4 days a week. And having that into making it a habit out of it, I think is the best way. So you don't have to think about it too much. That's what I would suggest for anyone that wants to live healthier and be healthier, is just make it a part of your everyday routine. So you don't have to think about having to go. You don't have to think about, hey, getting dressed, going to the gym. You just have to put it in your schedule like a meeting, just make it part of your habit. That way you consistently do that for about 30 days. You consistently do it for 60 days. And then after you do it for about 90 days, it just becomes like part of your day, And that's what I do before I go to work in the morning, 30 minutes. I go on my stationary bike 3-4 times a week, and I fulfill my exercise requirement. And that to me is actually really important because it keeps my immune system up. It keeps me in a good mood. It keeps my stress levels down, and it just overall makes me feel pretty good emotionally and pretty mindful of all the things I need to do for the day. The third component is sleep. So there was a lot of research recently that said sleep is so important for our bodies. It's actually a way for our bodies to recharge, so to speak. It improves our memory, it improves our mood, helps us deal with stress, improves resiliency. So for me, one of the things I started recently doing was trying to go to bed the same time every day and trying to wake up the same time every day and trying to keep a consistent sleep routine. There's this new concept called sleep hygiene, which I think is really important for everybody to know. I think sleep is so underestimated and undervalued in our society that we don't know that sleep is actually one of the things that brings wellness. You feel much better after a good night's sleep. So, for your younger generation, I would definitely recommend before you go to sleep, put away your phones, put away your screens, take a 30-minute break from all your screen devices so you can kind of calm the brain down a little bit and get your brain and body get ready for some good sleep. So one of the things when you ask me about how do I incorporate lifestyle medicine, how do you incorporate wellness into your busy schedules, I really suggest just making it into a habit and starting small. I don't think you can do everything all at once, but if you start making a habit, just like, meal prepping once a week, start making a habit of, hey, exercising 30 minutes in the morning when I wake up. And slowly these habits will become part of your daily routine and you will actually be healthier for it down the line. Think of it as investing in your future health when you're in your 50s, 60s, and 70s.
Thank you so much for your answer. I think what you said is really important because like you said, getting the proper nutrition is so important, especially working in such intense work environment. Like you said, something that I relate to is because I'm in track and my coach is always telling us to eat, get all of our vitamins, all our nutrition, especially protein and everything to have the energy to run in track. And so I think it's similar in the medical field because the environment is so intense. So I think having a good nutrition and food is really important. And also you said that it also helps with your mental health. I think that is really important too because especially your physical body, your mental body has to be healthy as well to be able to work, and stay healthy and everything. So thank you so much.
Oh, you're welcome.
Thank you. Well, that wraps up our fireside chat. I feel like this was a very, very, I learned a lot from this fireside chat. And I'm also happy to know that I resonated with a lot of what you said in your other answers. So that kind of lets me know that I'm on the right track with the nutrition stuff. And I will also look into sleep hygiene. That sounds really interesting. So I'll look into that today and share with my family. But Dr. Ravichandran-Kumar, thank you so much for taking your valuable time to share your insights with the GVHS Medical Society. We have all learned from this fireside chat, and we are very excited to share this with our club next week.
Okay, great. Thank you for having me. It was an honor.
Yes, of course, anytime.
Okay.
Okay, thank you. Bye-bye.
Bye.